Matt, now, if that recent sunshine has tempted you to take a walk in the countryside, you might want to listen to this.
Yes, ticks live in grasses and bushes and carry a bacterial infection called Lyme disease, which can be transferred to humans. With a bite, sufferers say not enough's been done to diagnose or treat the disease. They're holding worldwide protests today to raise awareness.
Yes, we're joined now by Emily Adams from the Liverpool School of Tropical Medicine and Nicola, who suffers from Lyme disease. Morning both, thanks very much for joining us. Let's just start with you, Nicola, first of all. You have Lyme disease and this is, from a tick bite, do you?
Yes.
What happened?
I got a tick bite on the west coast of Scotland in 2008. I'm an entomologist, so I wasn't really bothered by it. I was out walking, watching deer. Found it about a day later, scratched it off with a fingernail, and then I became ill. About 11 days later, I had a severe flu-like illness, sore stomach, sore knees, and then I developed symptoms of meningitis. So I went to the doctors, they sent me to the hospital. By the time I got there, I couldn't walk. It affected the nerves going to my legs.
And take us through the story. So, I mean, what happened? What was the process of treatment?
So, I was hospitalised and given a short course of low-dose antibiotics, but it was clearly meant neurological, so I really should have been given intravenous antibiotics at that point, but I wasn't. I was sent home with a short course of antibiotics, and I didn't really recover. I was getting worse. I was getting more and more symptoms. I was getting dizziness, nausea, confusion, cognitive problems, memory problems. I was finding it difficult to have a conversation. Twitching muscles, heart palpitations, sleep disturbances, a wide range of things.
Gosh, yeah.
So by this point the NHS had had a negative test, so they were doubting the diagnosis of Lyme disease, and they said, oh, it's probably post-viral fatigue or in your head. They weren't really sure. And as an ecologist, I was sort of aware of Lyme disease, so I went and sought out a private specialist who diagnosed me based on my symptoms. And then a positive blood test came later.
And I know you're still affected by it now. Nicola, I mean, it is difficult to diagnose. And do you think people should perhaps... Emily, it's difficult, isn't it? Should people be more aware, do you think, of the potential for this to happen? Because it's obviously had a big impact.
Yes, exactly. And I think part of the protest today are to try and raise public awareness to the problem and also to the medical community to make sure that doctors are knowledgeable about the signs and symptoms. They know how to treat the disease. That's part of the reason.
The situation that Nicola talked about earlier, walking in the country, a lot of people have had that. A lot of people have had tick bites.
Yes.
I mean, you can't protect against that, can you?
Well, we advise if people go out into the countryside, they should try and wear long-sleeved clothing. They should have long trousers. Perhaps wear gaiters if they do a lot of walking in the grasses. Wear insect repellent, preferably with DEET in it.
But if you do get a tick bite, I mean, is it just lucky dip as to whether that tick is carrying the disease?
Yes, not all ticks carry disease. It's only a relatively small percentage. And we just have to be aware, if you have a tick bite, if you come back from a walk, then make sure you remove it as quickly as possible. Don't burn it, don't put gel on it, don't put Vaseline on it. But if you have a tick remover, which you can pick up from on the website or at veterinary practices, that you remove it as soon as possible. And if you have some very fine tweezers, you can also remove it yourself. And a tip I just picked up from Nicola is using a small cotton thread and the loop around the mouth parts and pulling it up gently if you're out in the wild.
I mean, presumably, if you've had a tick bite, you should go and see your GP as well.
Yes, if you have any of the signs and symptoms of Lyme's or you're worried about, then you should immediately go and see your
Does it affect animals as well? Dogs?
Yes, yeah, dogs are infected and our livestock. If you're taking your dog into the country, then when you bring him back, then just give him a brush, check him for ticks. Remove them if possible.
And how are you now? What's the long term?
I'm a lot better now. I'm on long-term treatment, and this is part of the problem, is that I've been able to pay for long-term treatment. I have to pay for my treatment privately. The NHS hasn't given me that long-term treatment. They only gave me a short course of antibiotics. Yes. And I'm in a very fortunate position, but a lot of people aren't, and people are denied access to long-term antibiotics. But there is some evidence that shows that long-term antibiotics work, and I've personally found that they have worked for me, and so a lot of people are going to be attending the protest.
Yes, and you said last week that you had a cold, and that because of Lyme disease, left you in a wheelchair for a bit, did it?
Yeah,
Just because of the impact on your nervous system?
I'm not very symptomatic today, but last week I was really quite ill, and that's because it gives you a compromised immune system, so any additional bugs that you pick up really floor you.
Okay, and thank you very much, Nicola.
Yes,
thank you as well. And we have a statement from the Department of Health. They say it is working to raise awareness amongst doctors and nurses as a helpline doctors can call. Public Health England has told us that it's distributing leaflets and advising people how to prevent tick bites.
Still to come on breakfast.